Hello everyone and welcome to Module 3. So this week we are focusing on vital signs, communication, and the office environment as a whole. So with that means that we are looking at 3 chapters this week, Chapter 5, Chapter 6, and Chapter 35. Now Chapter 6 is something that we actually have discussed. We started talking about last week. It's looking at the safety in the office environment, both looking at OSHA, how to handle floods and fires and safety concerns. So I'm not actually going to talk about that in this week's video, as it is stuff that we did talk about in both your lecture and your lab course last week in Module 2. So we're going to start this week looking at Chapter 5, which is talking about communication. Now, communication really is a necessary requirement for everyday life. There's not one day that goes by that we don't communicate with someone or other people. Now, in the medical field, the ability to communicate is essential for success. Everything from calling in a prescription to be refilled to documenting a patient's complaint or their reason for visit, we have to communicate with someone. The concern that we have for our patients will show in our words, our actions, and our gestures and tone of voice. So we have to have the ability to communicate with a wide variety of people in the field, anyone from patients to physicians to vendors or coworkers, the families of our patients, everyone that we can communicate with. And there are many different channels in which we can communicate with people. For example, we can have face-to-face discussions, conversations over the phone, looking at letters and written words, faxing and emailing, both forms of communication. But it doesn't just end there with good communication. We need to have good interpersonal skills as well. Things such as being self-aware, knowing your character, your values, and your attitude. Understanding different learning styles. Maybe they're auditory, meaning they learn by hearing. Visual, they learn by seeing. And kinesthetic, they learn by touching and doing. So now that we have discussed communication a little bit, we need to understand that there are 2 different forms of communication. There's verbal, which is using spoken words, sounds, and tone of voice. When you as a medical assistant are speaking to a patient, you want to speak loudly enough that they can hear you, but not so loudly that you're breaching confidentiality or yelling at them. We need to be cautious with the words that we choose. Choose words carefully and try not to be rude or impatient with patients. Do not use any technical terms or medical jargon, as most patients may not know that terminology. And try to take into consideration their education level. But beyond that, you have to have a positive attitude. Be empathetic, not sympathetic, so that you can understand what the patient's experiencing, but don't experience it yourself along with them. Nonverbal communication includes all the facial expressions, gestures, body language, eye contact, grooming, and mannerisms we use when communicating. It is so important that your nonverbal and your verbal communication match. Otherwise, the patient will get a mixed message. Now, when we're talking about communication, we need to be aware of some barriers that can hinder a communication line. For example, defensive behavior is the #1 thing that can hinder a communication. If you or your patient is in a defensive or aggressive manner, that communication line is broken from the beginning. Using medical jargon. Again, if a patient doesn't understand it, they're going to get confused and that line of communication will be broken again. And understanding cultural issues, such as different languages, diverse viewpoints, stereotyping or biases that we have, along with prejudices, and maybe religious issues. All of those can cause a barrier to communication. So that's Chapter 5 kind of in a nutshell for you. Let's move on to talking about Chapter 35, which is dealing with vital signs. So vital signs are the full responsibility of a medical assistant. They are essentially a quick snapshot of how the patient's body is functioning. And there are 6 main vital signs that we look at and are responsible for as medical assistants. Those are weight, height, temperature, pulse, respiration, and blood pressure. So let's talk about each of those a little bit more in depth. Let's start with height and weight. So typically, these two vital signs will get completed together, as most of the time the scale is the height measuring stick, or vice versa. So weight is one of the first vital signs you will take for patients. This should be done in a private area to make the patient feel more at ease about having it done. Always have the patient remove their shoes and any heavy outerwear if possible. If the patients refuse to remove the items, make sure that you document in the chart that they were left on. And also, when you document the weight, it is always written in pounds. Height is taken in order to get a true patient's measurement, so you want to do this again without any shoes on. Typically, again, why we do height and weight together, they'll already have those shoes off. You'll have the patient stand with their heels, buttocks, and back of their head touching the measuring stick or the wall. Then you'll place the L-shaped bar on top of their head, not on top of their hair, especially for women who tend to wear their hair on top of their head. Make sure that you're putting it on their head, not their hair. And when you're recording a height, it is always put in inches. You do not use feet and inches anymore. So for example, instead of being 5'2", a patient would be 62 inches. Next we have our temperature. And temperature is looking at the patient's internal core. We take a normal body temperature, and typically that is anywhere right around 98.6. Generally, we always record a temperature in Fahrenheit, but thermometers nowadays can do both, so pay attention to which one you have up. And there are 5 sites where a temperature can be taken: orally or under the tongue, rectally or in the rectum, auxiliary, which is under the armpit, aoral, which is in the ear. It's also called the tympanic membrane, and temporal, which is across the forehead going from temple to temple. Now, patient's body temperature is usually at its lowest first thing in the morning and rises throughout the day. And there are some factors that can affect a patient's body temperature, such as the time of day, age, gender, physical exercise, emotions, pregnancy, environment, infections, medication, and certain types of food or drink. Next, we have your pulse and respirations. Again, these two are done together because of the fact that you don't want a patient to know you're counting their respirations. So as you can see in the picture, he's holding her wrist as if he's taking her pulse, but he's actually looking at her body for respirations. Now, a pulse is the number of times a heart beats per minute. The pulse is a wave of blood that comes through the body when the left ventricle contracts and relaxes. The average pulse rate for an adult is anywhere from 60 to 80 beats per minute. And you typically take a pulse at the radial artery, which is located on the thumb side of your wrist, for about 30 seconds, and you'll multiply that by 2, so it completes a full 60 seconds. However, if you go to take a patient's pulse and you realize that it is irregular, you should take a pulse for the full 60 seconds. Respirations are the act of breathing and is the process of one inhalation and exhalation together. Respiration rates indicate how well oxygen is being provided to the tissues of your body. Respiration should be taken at the same time as a pulse so that the patient does not alter their normal breathing pattern. And the average respiration rate for an adult is 12 to 20 breaths per minute. Again, you would take it for 60 seconds or 30 and multiply it by 2. And finally, we have our blood pressure. And this is by far the most important vital sign that a medical assistant will take. It helps to aid in the diagnosis and treatment of your patients. Blood pressures consist of 2 readings, a systolic and a diastolic pressure. The systolic pressure is the first beat that is heard and typically the highest point of pressure in a blood pressure. Diastolic, on the other hand, is the last beat that is heard or the lowest point of pressure when your ventricles relax. And there are 2 key pieces of equipment that are needed to help obtain a blood pressure. Those are your stethoscope and your sphygmomanometer, or a blood pressure cuff. Now, the average blood pressure for an adult is 120/80, and typically we do write these as a fraction. But just like any other vital sign, your blood pressure has quite a few factors that can affect it. For example, emotion, age, exercise, obesity, certain diseases, shock, dehydration, and even anxiety. Now, I know in your lab classes within the coming weeks you will be practicing these, so they'll start to make more sense as you progress through and use them and actually perform them on one another. Alright guys, that is all I have for chapters 5 and 35. Again, please remember that you need to read all 3 chapters on your own, so that way you can have the best information possible for discussion boards and quizzes this week. So for this week, you do have a discussion board again, and it's looking at communication. So what you're going to do is actually watch a short video on communication with a person named Hannah. And what you'll do is after you watch that video, there are about 4 questions that you do need to answer. Please make sure that you're answering these in APA format with references and in-text citations. And your initial post will be due on Tuesday, July 18th by midnight. And again, you'll have to reply to at least 1 classmate no later than July 22nd, which is Saturday, by midnight. Again, you can reply to multiple people and multiple classmates, and even the instructor if I do comment on your discussion board, but only replies that are to classmates count for your grade. This week you also have another VIS summary to look at, which is looking at the human papillomavirus, or the HPV virus. Again, there is a there is a rubric up for you to look at, so you make sure that all of the correct information is within your review and your summary of this paper. And lastly, you do have 1 quiz this week. It is on vital signs, and it is 20 questions long that are all multiple choice, and you have a 30-minute time limit. Please make sure that you complete your VIS summary and your quiz no later than Sunday, July 23rd by midnight. If you do have any questions or concerns, guys, please make sure that you're reaching out to me either via email or via phone, and my phone number, a direct line on campus, can be found on your course homepage. I hope you all have a great week 3, and I look forward to seeing all of your discussion boards and course projects come through. Bye, guys.